All right, so welcome everyone, and thank you very much for joining us this evening for an update for families on COVID-19. My name is Katie Bliss. I'm a librarian at the Central Branch downtown, and we're joined tonight by two presenters. We have Nola Aigner Davis from the Polk County Health Department and Dr. Amy Shriver, a pediatrician at Blank Children's Pediatric Clinic. Before I introduce our first presenter, I will go ahead go over a few housekeeping items for you all. So first of all, this program is being recorded, and a link to the recording will be on the event page, hopefully by the end of the week. And then after Nola and Dr. Shriver speak, we will allow for some questions from the audience. So if you can hang on to those questions until then, just in case they do happen to answer them along the way. And then just go ahead and type them into the chat. And then once we get to that Q&A section, I will read those out for the speakers to answer. If at any point you're having technical issues, viewing this, hearing this, please feel free to email me at reference@dmpl.org. I'll be monitoring that throughout the program. And finally, if you are looking for any information about getting tested for COVID-IV, please visit the website testiowa.com. You can get some information there. Okay, so our first speaker will be Nola. She is the Public Health Communications Officer for the Polk County Health Department. She graduated from the University of Northern Iowa with a Bachelor of Arts degree in Public Relations and a Master of Arts degree in Communication Studies with an emphasis in organizational communication. Outside of her work at the Health Department, she is an adjunct instructor for Buena Vista University and Mercy College of Health Sciences. And she's an active member of Junior League of Des Moines and Dreamcatchers Foundation, Inc. So I will let her take the floor. Thank you, Nola.
Thank you very much. So good evening, everyone. Like Katie said, I am Nola Aigner Davis, and I am the Public Health Communications Officer for Polk County Health Department. And I'm just getting my screen to share. Give me 1 second. Okay, it should be working. Okay. So, like I said, I'm Nola Aigner Davis. I'm the Public Health Communications Officer for Polk County Health Department, and I am going to give you a brief update of what we are seeing so far with COVID-19 and some of the trends and the data that we have seen over the last couple of weeks. So as of today, September 9th, 2020, we have seen in Iowa a total of 71,600 positive cases. In Polk County, we have seen 14,191 positive cases. Now, if you look at the per 100,000 total data for the state, we are averaging around 2,000, just under 300,000 per every 100,000 persons in Polk County. Now, when we look at our positivity data, the whole state of Iowa is about 10.5%, and we are about 12.2%. So we are still above community spread. And when we look at community spread, we look at anything over 10%. What we really want to see is it under 3% to know that we are seeing sustained deceleration in the disease. Now, we've gotten close to that sometime in June, but we have never seen that. We went through a period where in end of May, June, beginning of June, our numbers were on the decline. The end of June, beginning of July, our numbers were on the increase, and we have not stopped since. If you look at positive cases with age 0 to 17 years old, state of Iowa, we're at 7%, and Polk County, we're at 7%. Iowa surpassed 70,000 cases over Labor Day weekend. Polk County and Iowa still remain high, but they are decreasing. Now, when we like to say we want to see decreasing, we want to see under 70 cases per day to know that we are at good numbers. We're still in hundreds and over 100 cases each day. For a while, Iowa was the highest state in the nation, but the Dakotas have us beat. North and South Dakota are number 1 and 2, and we are number 3 with the highest cases per capita in the United States. Now you can kind of see the positive cases. We are on a nice decline. Now, hopefully we can say that this is a positive trend, but what we notice after every holiday weekend, there is an increase in cases. So it's going to be interesting what we see in the next couple of days after Labor Day weekend. So we're still averaging the most cases per 100,000 in the population. That's just also because we are a very heavily populated, the most heavily populated county in the state. Here's positive analysis for schools. Now, what we look at is, again, looking at community spread, we really want it to be under 10%. Today in Polk County, our positive case analysis for the school data was at 8.7. Last week it was at 10.6%, and 2 weeks ago it was at 8.9. So we are slowing down. Hopefully, again, we can see a deceleration in cases, but again, when we start to see a holiday weekend in those cases, it's going to be interesting in what we see in the next couple of days. Here is patient hospitalization data as of September 7th. Now, one of the things that we are seeing in Polk County, we're seeing a higher number of individuals hospitalized. And so the top number is what you're seeing in Polk County, and the bottom number is what we're seeing in Region 1. Now, Polk County falls under Region 1, but this is also several other counties in Region 1. So again, we're still seeing high COVID numbers of patients that are hospitalized. And it will be very interesting to see what it starts to look like again when we start to hit flu season and the hospitalization numbers. The CDC has changed their post-travel recommendations. Now, it used to say that we would not recommend anyone traveling internationally, and right now the CDC has changed that. So they are not putting travel restrictions on that, but we strongly encourage everyone to practice the same social distancing that we are telling everyone to practice. So maintain social distance, wear a mask, wash your hands often, and use hand sanitizer. Be alert for those CDC, be alert for any COVID-19 symptoms. And again, just keep following that CDC guidance and your local and state recommendations and requirements for after you travel. Again, we know that the best way to protect yourself is to stay home. So if you don't have to travel, please don't. Again, we know that COVID-19, we're seeing community spread throughout the whole world, and I can show you that here in this slide. This looks at the risk level for COVID-19 throughout the world. Orange is high risk, and then the rest is, you can see, moderates to no risk. There are very few countries in the world that are very at a low risk. So if we don't have to travel, we shouldn't be traveling. So this is information, again, from the CDC that's really looking at if you are traveling into the United States from other countries, you have friends and family that are coming. There are several countries that are going to be prohibited to travel to the United States. So take a look at this. I think if people are traveling to and from the United States, it's always very important to check the CDC's website for any of that information, because we know this information changes constantly and daily. So please use the CDC as your best resource for any travel related information. I think the biggest thing that we know with COVID-19 is we have to take steps to protect ourselves. Now, we know that there is a vaccine, hopefully coming soon, but until then, and until we see how the vaccine works, we have to keep practicing the everyday actions to prevent it. So keep doing those mitigation strategies because we know they work. So stay 6 feet away from others. Wear a mask whenever you go out in public. Let's make sure we're not touching our eyes, nose, and mouth frequently. Stay home when you're sick. Disinfect frequently touched objects. Wash your hands and cover your cough and sneeze with a tissue. I mean, we know these strategies work. We have to keep practicing these strategies. Otherwise, our numbers will still remain as high as they are right now. Some of the things that we are kind of seeing at the health department that we really want to keep encouraging our community to follow is if you are in quarantine, you need to stay in quarantine for a full 14 days, even if you have tested negative. Now, we get asked often, well, why 14 days? Well, we've seen the incubation period for this disease start to develop symptoms anywhere from 2 to 14 days. And we've even seen people develop symptoms even on day 14. So every disease is different depending on how it incubates in your body, but we know with COVID-19, you need to stay home for a full 14 days. We've had people test negative on day 5, and we've seen a positive test day 9, day 10, day 11. So it's a really great way for you to stay home and prevent infecting others. Now, if you're sick, stay home and avoid others until you're well. Dr. Shriver will probably talk right now. It's also allergy season, and some of the symptoms of COVID-19 kind of mimic allergies. So if you feel sick, if you have a fever, if you have a cough, sore throat, runny nose, stay home. Call your medical provider and have a conversation with them. They will know whether you need to be tested or not for COVID-19. Now, if you do have COVID-19 and are sick, you need to follow the guidelines from the Centers for Disease Control and Prevention. And I'll talk about that here shortly. And if you have been tested for COVID-19, please stay home and avoid others until you get your test results. We've seen people going back to work, going back to school, and they are testing positive. And then they have put other individuals at risk. I think the biggest thing that we really need to keep educating our community is that everything you do impacts everyone around you. So the people you're around, the places you go, impacts your loved ones and your family and friends. I mean, just because we are around people that we love and that we trust, we don't know who they have been around. So it's really important that we are following those mitigation strategies like I had discussed earlier. So what's the difference between isolation and quarantine? Isolation is used to separate people who are infected with the SARS-CoV-2 virus. Now, that's that virus that causes COVID-19 from people who are not infected. So if you have tested positive for COVID-19, we really look at a symptom-based approach. And that can be you are released from isolation. Now, you have to be able to answer yes to all 3 of these questions before you can be removed from isolation. It's been at least 10 days since your first symptoms appeared, at least 24 hours with no fever-reducing medication, and your other symptoms of COVID-19 are improving. So isolation is that you have tested positive, and we are isolating you away from others so you don't infect them. Now, what if you've tested positive and you do not have symptoms? Well, then we'd like you to stay home for 10 days since you've had your positive test. Now, what is quarantine? Quarantine is used to keep someone away from others who might have been exposed. So if you are a parent, a guardian of a student, and you get a letter saying that your child is a close contact of a positive case and your student needs to be home and isolate for 14 days, that's because they have been around someone who has tested positive and they need to stay home for 14 days so they do not develop any symptoms and then put additional individuals at risk. So they stay home for 14 days so they don't infect others. And like we had discussed earlier, that you have to stay home for 14 days. Just because you get a negative test, that doesn't mean you're out of the clear, because we know that during any time within that 14-day window, you can test positive for COVID. You've seen someone test positive anytime within that 14 days. Now, one thing I didn't mention and that I want to mention quickly is that flu season is right around the corner. The CDC, Centers for Disease Control and Prevention, Polk County Health Department, recommends anyone over the age of 6 months to get their flu shot. Polk County Health Department, starting September 28th, you will have a drive-up flu clinic. And you can drive up to our back parking lot. There will be signs telling you where to park. You call a number and one of our nurses or medical staff will come out and give you a flu shot. Just drive up, put your arm out, and there you go. It's easy as that. I think it's really important that people are getting their flu shot this year, because we know that individuals can get the flu and COVID-19 at the same time. Getting your flu shot is the best defense to keep our community safe and healthy. And when we get our flu shot, we can have our hospitals are able to treat the most vulnerable patients. And so it helps to keep our community healthy, and it helps to not overwhelm our medical system. So we really, really encourage anyone to get their flu shot. And so if there's information, if you were looking for information on the health, on where to get your flu shot, you can visit polkcountyiowa.gov/health, and you can visit our website or social media to find more information about the flu. So Katie, I'm done. Are there any questions in the chat?
No, actually, no questions so far. So if you are all done, we'll go on to Dr. Shriver.
Okay, thank you very much.
Thank you, Nola. All right, so Dr. Amy Shriver, MD, is a general pediatrician at Blank Children's Pediatric Clinic and assistant professor of specialty medicine at Des Moines University. She is the medical director of the statewide nonprofit Reach Out and Read Iowa, which partners with pediatric primary care providers to give books and shared reading guidance to children and families at health maintenance visits. Dr. Shriver is on the executive board of the Iowa chapter of the American Academy of Pediatrics, as well as the AAP's National Council on Early Childhood. She heads the chapter's mental health committee and is the Iowa chapter Catch Grant facilitator. Dr. Shriver collaborates across the state with organizations such as Iowa ACEs 360, Prevent Child Abuse Iowa, and IAEYC to promote relational health and mitigate the effects of stress on children and families. Thank you so much for joining us.
Hi, can you guys all hear me?
Clear.
All right, great. Well, thank you so much for inviting me tonight. This is a great opportunity for us to touch base just right after schools have kind of gotten rolling. So here are my disclosures. So first of all, I have no relevant financial information to disclose, but I do want you to know about Reach Out and Read Iowa and how much early literacy matters to me and my patients. And also I'm married to a librarian, so I have a particular fondness for libraries. So thank you to the Des Moines Public Library and to Caitlin for this invitation. I do also want to say ahead of time that there are so many complicated questions when it comes to who should be tested for COVID, and I'm going to have to defer some of your testing questions today, but I have hopefully some other answers for you as we talk about schools. So I do want to address the elephant wearing a mask in the room, which is COVID fatigue. We've been social distancing and masking for 170 days now. Are we over it? Yes, we're over it, right? We just wish it were done. We miss our friends, we miss our weddings, we miss the parties, we miss, spending time with our family. Everything just sucks right now and I'm just really exhausted, right? Is this kind of the sentiment you're hearing where you are? Because this is what I'm hearing every day in my clinic. By the way, I see people not masking all the time and they're okay. So, Didn't we already flatten the curve? So why are we keeping on with this? I thought we were only going to do it for a short time. I feel like this was an old bait and switch situation. Is this whole thing overblown? You know, isn't this like any other virus? Don't we just walk around getting viruses all the time and we're okay? So these are some sentiments out there because this has been dragging out so long that I want to address head on, because I think Nola highlighted it so well. This is still a serious problem. And I might not be as much of a public health expert as Nola, but I saw her curve and it did not look flat to me. There were quite a few bumps on there. It looked like a couple of camels were riding on that curve. So how do we address this COVID fatigue? So many of us have started expanding our COVID bubbles. So for the first month or two of COVID, I pretty much didn't see anybody that I didn't have to see. I was living with my family and we didn't go anywhere and we didn't do anything and we just hid in our little bubble. And that's the very, very safest way to be. But it turns out that human beings are social animals and we actually need each other. Otherwise we get really depressed and sad and angry and we feel like we're not very functional. So it turns out that you know, many of us have started opening up our social bubble a little bit so that we can maybe see grandma, or we can see our best friend, or we can just get together with someone and maybe stay 6 feet apart. So, you know, the bubble is something that you can still do very safely if you are smart about it. And I'm sure Nola can comment on it as well. But it is something that many people have needed during this time to just feel like, you know, they are going to be able to get through COVID. So as Nola had said, this is still real. Like, everyone was terrified in March and April and even May. We were scared. And then people went through different phases of COVID, of denial and anger and grief. But this is still very, very real. And this is a graph from not too long ago that says, hey, we are, you know, spiking still with new cases in Iowa. So we can't give up. We can't have fatigue and we can't just throw in the towel. We have to keep up the good fight, wearing our masks every time we're out in public, not just to protect ourselves, but to protect those around us that we care about, our neighbors, our friends, the ones that are the most vulnerable out there. Physical distancing still needs to happen. Stay 6 feet apart. If you don't need to be close to someone, just don't. Washing those hands, quarantine or isolate, you know, you have to do those things that Nola had referred to in order to keep safe. And she's right, you know, people are trying to ignore those rules and saying, oh, those rules don't apply to me because I need to go to work, because my kid needs to go to school. And that's a real barrier to us fighting this and bringing our numbers down. So here's just a little graph from last week. We were the largest, having the largest rate of new cases until I guess the Dakotas took us over. So I guess we can't always be number one. But I do think that this is my silver lining for COVID, which is that the scientists will eventually be the heroes of our story. They're working frantically to make a safe vaccine for COVID that will hopefully eventually be one of the reasons we'll be able to hug our loved ones again. So yay for science. So now, you know, it's been months of people preparing for school. Schools have been working so diligently with the county health departments and with medical providers and with families, and just really, you know, working overtime trying to figure out how to make school happen for kids. And, you know, a lot of people are just wondering how it's going to go or how it is going. So, you know, families, moms, dads, and other caregivers are wondering, is my child going to get sick? Will my child get sick and then bring it home to us? And remember, we have people at home that we are vulnerable people. How's it going to affect me, my little baby, grandma? How is it going to affect my ability to work? What about the other siblings at home? Do they then have to quarantine if my kid that got sick is quarantining or isolating? And then which learning plan is going to be best? I'm working from home. How can I work from home and have kids at home learning? Or I'm working at work and my kids are at home. How's that going to happen? Hybrids, is that going to work? How do I know if hybrid, virtual, or in-person is going to work? It's so confusing for families. Kids also have some concerns. I'm afraid of COVID. There are a lot of fears, anxiety, depression. We're seeing a lot of kids just with increased mental health issues. I miss my friends. Some kids are staying home instead of going to schools across the state, and they miss being in that interactive environment. I miss my activities. Some sports are closing, and so kids aren't getting to do their sports or their play their instruments or do some of the other activities they loved. Some of my friends are at school. Some of them are doing virtual. They've like split us up in essence, and that is upsetting. And then, hey, I don't really love this mask situation, right? Although I will say, having seen plenty of kids come into my clinic with masks, kids are incredibly adaptable and they're doing great for the most part. They are really, really rising to the occasion. So teachers also concerned, right? How do I stay safe? This is like me really putting my life on the line here, getting in front of all of these kids. How can I plan my curricula not knowing what's going to even happen tomorrow? So stressful. What about if I get exposed? What happens to me, but then also what happens to my class, what happens to my family? Do I get a mask break? Is that a thing? Do the kids get mask breaks? Because I really want one. And then what about funding for schools, right? Schools have got to turn their lives upside down to figure this out. And why aren't they being better funded, right? So there are a lot of concerns all around. So when it comes to COVID, it's important to kind of have a grasp for what are we looking for, especially in kids. You know, all these people and families are saying, well, I'm going to send them to school, so I guess we'll look and see if we see any index cases, and then we'll have to figure out what to do. So what does COVID-19 look like in a kid? The answer is, I'm sorry to say, almost anything looks like COVID. Many children have mild or no symptoms. You may see fever or not, fatigue, muscle aches, loss of taste or smell, cough, chest tightness, shortness of breath, nasal congestion, runny nose, sore throat, nausea, vomiting, headaches, weakness, poor appetite, conjunctivitis. And then, of course, there can be complications of COVID, including that multi-inflammatory syndrome in children that you might have heard of. So guess what? Pediatricians and other primary care doctors, your job got a lot harder. All of a sudden, what you thought you could manage and diagnose is totally, totally different. So COVID looks just like a case of influenza. It looks like a strep throat. It looks like seasonal allergies, or it could just look asymptomatic. That kid who looks just fine might walk into your clinic and have COVID. So the lack of specificity of signs and symptoms and the significant proportion of asymptomatic infections make it really hard to identify COVID in kids. So it's a challenge and it mimics so many things. So that's why I have the viceroy and monarch over here mimicking each other. So it's so hard to know what schools should do, and schools had a hard time figuring that out too. And of course, public health experts like Nola had to weigh in and say whether or not it was a good idea to do in-person school. And then the American Academy of Pediatrics, my mothership, also weighed in. And what they said was that schools are really fundamental to child and adolescent well-being and development. They provide, of course, the education, right? The academic instruction, so your child knows how to add and read and knows about history and science and music and art and all those other things. But also really, really developing those social and emotional skills. Safety, school is a place of safety. Some kids, their homes aren't really safe places for them. And so identifying signs of abuse and neglect can happen at school. Schools can be a place for reliable nutrition. Some kids don't have enough to eat at home and they rely on the school's nutrition for their health. It's a place where some children with special needs will get physical therapy, occupational therapy, speech therapy, mental health services, special education. So there's a lot going on at school besides the typical classroom you might imagine. And then so important is that school actually gets our kids moving. And during COVID in my pediatric clinic, what we've seen is an incredible rise in the BMI of our children. So our children are taking in lots of energy and they're not burning it off. So they're storing it, kind of like a bear stores energy over the winter. And that's really not how our bodies are designed. So it's creating some potential future health problems. And then schools, of course, are a way to address racial and social inequities. So getting a good education should be an equal right for every child, no matter if they're Black or white, no matter if they're rich or poor. This is the chance that every child deserves to have an equal and excellent education. And what we're seeing is that COVID is creating huge challenges and kind of expanding what we call the opportunity gap in kids. So it's causing a lot of trouble because it's hard to make everything equal in this scenario. So AAP recommends, when possible, and remember I have a little star by that, schools should attempt in-person learning. But here's where schools need to work with the public health department. If community prevalence is too high, you have to change that plan. You have to be able to pivot to keep people safe. School policies have to be flexible and nimble in responding to new information. Policies need to take into consideration the community prevalence. Partnerships need to be formed and they need to be effective, talking to public health experts, schools, and medical professionals to help understand what kids need and how to handle outbreaks. And then policies need to be practical, feasible, and appropriate for children's developmental stages. So it's a challenge to meet all of these check marks at schools. Then I do want to really emphasize that by estimates, the average school district is spending over $1.8 million on health and safety measures to reopen during COVID. And schools really do need extra funding to do this. So here's a picture of my kids, and we live in Dallas County, and I don't know if you saw that map, but we have, I think it was something like a 7% in Dallas County. So we're still open for business. I like this quote by Eleanor Roosevelt: do one thing every day that scares you. Well, guess what? We're going to school every day, so I guess that counts. Are they safe? So I just kind of want to review what pediatricians have been seeing in terms of studies and trends that are coming out about kids and COVID. So this is from the CDC. Children are 22% of the US population. I like to say 100% of our future. But they're only seeing about 7.3% of all cases of COVID-19 are kids, right? So it's less than the total population of kids. So how do you interpret that? Well, does that mean that kids are less likely to get COVID if it's not equally distributed through kids and adults? Well, we'll see. We'll see what the evidence shows. COVID-19 hospitalization rates are lower than hospitalization rates in adults. So that's good. Kids aren't hospitalized as much from COVID-19. And less than 0.1% of COVID-19 related deaths were among children and adolescents. So although there have been child deaths, they're at a much lower rate than anyone expected when COVID first started. So I have bad news though. The other shoe is coming down, and it's coming down fast. So because of the rapid response that we had in March, where we said, shut down all the schools, everybody go home and hide in your homes, that maybe has given us a false sense of security about kids and COVID. Because we think we might have reduced the percentage of kids getting exposed to COVID with those early mitigation strategies. And it might explain the low incidence in children compared with adults. Now, so what's going to be important is comparing trends in the pediatric infections before and after the return to in-person school and other activities. So we're still collecting this data, and we have yet to determine what that will look like coming up. So it's always scary to be in the middle of data collection and waiting for that other shoe to drop. So really, what do we know so far about how children spread COVID? It's very inconclusive, and I know that's hard to hear, but we did collect some evidence that said, hey, children are less likely to have severe symptoms, they're less likely to have symptoms when they get COVID, and they're less likely to die. But children can spread the virus effectively in households and camp settings, so they are spreading it more than maybe we thought early on. And all the policies that we are instigating in schools can mitigate but not eliminate risk. So there's always the potential risk of COVID in schools. So this is kind of a journey for what we as pediatricians first thought when people were writing those recommendations and kind of seeing the first iterations of what COVID looks like in kids. at first we thought children aren't as likely to spread COVID as adults are. And why did we think that? Well, so in Australia, kids were in school kind of earlier than our kids were in school. And they kind of looked at the incidence of this COVID spread in a particular Australian school. So 9 students and 9 staff got infected with COVID across 15 schools in Australia, and they had contact with 735 students and 128 staff, but only 2 secondary infections they noted from these 9 students and 9 staff. So we thought, oh, well, maybe that it's not spread as much by kids in schools, so that could be hopeful. In Switzerland, what they did was they took hospitalized kids with COVID and did contact tracing to find out like what the index case was. And only 3 of those had a child as their index case. The rest of them we thought were becoming infected through adult contact. So we thought, well, maybe child to child and child to adult contact isn't spreading COVID as much. And then in China, same thing. They had 68 hospitalized kids with COVID, and they did some contact tracing with that, and 96% of those were adult to child and not child to child. So that's good, right? That means maybe kids aren't as contagious. And then in France, this 9-year-old exposed 80 classmates and none were infected. Well, we don't really know the situation surrounding that, but we were hopeful we could put it in this big pile of studies that said, hey, or observational studies that said, hey, maybe kids aren't as contagious. But well, maybe that's not true, right? So in Israel, they opened schools on March 13th, or on May 3rd. And on May 17th, all the schools were open. And then 2 days later, there was a huge heat wave and nobody could handle wearing their masks. So they took all their masks off. And then just 6 days later, there were 2 index cases in the schools. And so on the next day, they closed all the schools and they tested everybody. And they saw that there was a 13% attack rate in students and 16% in staff. And so then later they did some tracing and they saw that 87 contacts outside of school were testing positive. So we're seeing that even who transmitted the most COVID, it was the kids from 7th to 9th grade. So now we're like, okay, kids can get COVID because they did get it in the school, and then they can spread it because these 87 contacts then also got COVID from these kids. So okay, so maybe they're more contagious than we thought. Oh darn, there's more studies. So South Korea monitored over 59,000 contacts of over 5,000 index cases and found that the attack rate was high in households, 11.8%, and then there's a lower attack rate in non-household contacts. But the rates were higher for contacts of children. So we're like, okay, now children are giving other people the COVID, and the kids ages 0 to 9 were passing it the least, and then people from 10 to 19 years old were having the highest rate of passing COVID along. So we're like, okay, well, we know that those kids in middle school and high school are probably going to pass it along. So, oh darn, we thought we were safe, but maybe we're not as safe as we thought. And then more data that kind of gave us a little, was a little bit of a bummer, was that there was this overnight camp in Georgia in June, and there were 597 Georgia residents attending camp. And then they said the kids didn't need masks, the adults were wearing masks, because this was back when we thought kids weren't that contagious. So then a teenage staff member left with some symptoms of fever and chills and cough, and then later tested positive for COVID. And then, so they tested 58% of the camp attendees, and 70% of those they tested were positive for COVID. So there are lots of COVID at this camp. Overall attack rate was 44%, and 51 of those were ages 6 through 10, 44 were ages 11 through 17, and 33% were ages 18 through 21. So they're all spreading it. So we can't really even say that the younger kids don't spread it. So, or don't get it. So kids can catch it and they can spread it, is now what we think. And are they carriers? So the short answer is yes, they have COVID in their noses. So recently a study at Lurie Children's Hospital showed that children under age 5 that have contracted COVID may have up to 100 times the viral load of COVID-19 compared with adults. And then the older kids, between 5 and 17, have the same amount as infected adults. We don't really know what that means. We don't think it means that those younger kids are super spreaders, that they're gonna fire COVID at us at higher rates, but it's just a significant study to say that I think the things we thought were true early on maybe aren't as true. So having said all of that, we still think it's okay to send kids to school for now. But what I say now may change tomorrow, or it may change the next day. And I know Nola says the same thing. So here are the AAP recommendations for school reopenings. Make sure to clean, disinfect surfaces, wash hands, try to keep that distance between 3 and 6 feet apart. Fewer students and staff in the classrooms, and then try to prevent the students from like getting in the hallways constantly up and down the hallway. So keeping kids in their rooms as much as possible, eating lunches at desks, using outdoor spaces if possible, masking everybody, and then you're going to have to pivot if and when the virus starts to surge. So schools are doing a lot of other things to mitigate risks. They are spending a lot of time outdoors. And then like my daughter used to have PE every other day, and now it's like you have PE the whole week. So that PE teacher sees the same group of students for a week, and then we'll see a different group. So it's not constantly that PE teacher is getting exposed to different kids every other day. And meals are being done together, one-way hallways, taping off hallways to keep kids organized and away from each other, trying to keep kids in their classes most of the time and not switching around a lot. And then they've done a lot to help mitigate risk on buses in terms of reducing the quantity of kids on buses, taping off buses, and everybody masking on buses. So just a couple words about masks. So cloth face coverings protect others and may protect you as well as the so when you put on a mask, you think, oh, I'm keeping myself safe, but I really want you to think, oh, I am keeping my neighbors, my friends, my grandma, my mom, everybody I love and everybody I see, we're keeping them safe. Some kids, it's going to be a struggle to get them to wear. Some kids will need to practice and learn. And then everyone needs instructions on how to properly wear a mask, because some people insist on getting their nose peeking out, and that's not proper. And then we don't recommend masks for kids under age 2. Also, if you are physically unable to remove a mask, we don't recommend you wear one if you're unconscious or incapacitated. And then masks are a challenge for a certain subset of children and adults who are deaf or hard of hearing, have speech or language services, or are English language learners. And there's probably a few other exceptions to the mask mandate. So I get this question a lot. Does mask wearing cause physical, developmental, or emotional damage to kids? So a lot of people out there are worried about, like, can you read people's social cues, and are you going to miss out on the social and emotional development with this mask wearing? And the short answer is no, no, that's not a thing. So kids and adults will, first of all, be physically okay for the most part. There's a couple exceptions out there, I'm sure, but mostly you can wear a mask and be okay. Normal oxygen levels, even kids with chronic respiratory conditions are okay to wear masks. There are almost no reasons why a school-age child should need a medical exemption, so think really hard before you call us and ask. And then if you're wondering about, can my baby interpret my cues when I'm wearing a mask? The answer is yes. Even babies and toddlers, and definitely school-age kids, can learn social cues and emotions from other nonverbal cues. Doesn't have to be your nose and mouth. They can see your eyes, they can hear the tone of your voice, they can see the way you move, they can hear the level of energy that you have. So there are a lot of other cues out there. So I think that doesn't need to be a primary worry for us. Some people ask me about face shields. Are they safer than masks? Can we use that instead? So a face shield is good for your eye protection, and I use them every day at my job. So it protects the person who's wearing it. At this time, it's not known what level of protection a face shield provides to people nearby from the spray of respiratory droplets. So although it might keep your eyeballs safe, it's not keeping your germs away from other people as well as you think it is. And there's currently not enough evidence to support the effectiveness of face shields for source control. So the CDC does not currently recommend use of face shields as a substitute for masks. So cloth mask wearing at school, okay? You may encounter a 1 or 2 person exception, or there may be some cases that I spoke about before, but face shields are not a substitute for cloth masks in general. As Nola said, flu season is coming, and so if you're wondering what you as a parent or community member can do to help everyone, including the kids staying at school, and help your doctors not become too overburdened, and help the hospital system and overall costs of everybody getting sick, then the answer is definitely get your flu shot, right? Wear your masks. Continue distancing. I know it's hard. I know we're all fatigued, but we are still meaning it, right? This isn't over yet. Continue washing your hands. Continue to keep kids home. You have to quarantine or isolate if you're sick. Keep getting your regular health checkups. So I've had a lot of people say, oh, well, I'm just going to wait to bring my kid in. What are you waiting for? We don't know when this thing's going to be over. It's so important to call your doctor, come in, discuss your concerns. It's totally normal to have concerns about that, but we as pediatricians really want you to come in and bring your child in for well child visits. And you too, as adults, we want you to be healthy. We want you to continue your maintenance checks as well. And then get your flu shot, get your flu shot, get your flu shot. Just a moment to mention kids' mental health. I have been seeing kids struggling with mental health. And so I have some tips for you guys just to think about all of us under stress right now. I mean, you will not find a single person who's not stressed out right now. So here's what I like to talk about in my clinic for dealing with stress. It's called CC123, and I created it with the Iowa ACEs 360 organization to just talk about stress, normalize stress, and to guide people into ways of positive parenting during stress. So the first thing we all need when we're stressed out is connections. You might need to, if you had a really stressful day at your job, you might need to call a friend and just kind of dump all over them and say, hey, this is what happened. Will you just listen? Thanks. Or you just need a hug from your partner when you get home. Kids need connections as well. It's especially important for our teenagers out there to feel connected with their friends and peer groups. That's an essential part of their social development. But we all need our friends right now. So make sure that you're being intentional about helping yourself and your friends feel connected in a safe way. Coping skills. Coping is one of the most important things that we can do during stress. In adults, we're getting pretty good at making our self-care plan. Hopefully we're thinking about it. Self-care for all of us includes getting enough sleep, getting good exercise, having good nutrition, having some mental health check-ins, having some time for relaxation, getting out in nature, and having really great relationships with others. So that's my self-care. That's what I recommend for you guys. I'm sure you have other ideas: laughing, watching a movie, reading a book, enjoying a bath, getting takeout and just curling up at home, whatever your coping skills are. But for kids, they also need routines. This is going to be helpful if your kid's virtual at home. They need a routine so that they know how to get their work done properly. They need routines to feel safe during a time that just doesn't feel that safe. They need routines to be predictable so they know what to do and when, and so that they're making sure to fit in things like exercise and relaxation. And then 1, 2, 3. This is just a great way to think about giving everybody grace and love during times of stress. So take one moment. If your child is acting out, or maybe you're acting out as a parent or caregiver, take one moment to stop, reflect what's going on. Why are they acting that way? Or why am I acting that way? And then feel and forgive. So empathize with them, figure out if you think it's stress related, and then just forgive what you can forgive. You know, lots of these things are not that big of a deal, but we're just a little irritable right now. So try to forgive as much as you can, while still, doing appropriate discipline for behaviors. And then forgive yourself as a caregiver or parent. This isn't a perfect time for anyone. None of us is running at 100% capacity right now, so just forgive yourself. And then 2 means 2 eyes for seeing and 2 arms for holding. We all need some more positive encouragement during our days. to help us get through stress. You know, it doesn't hurt to just say, hey, good job. That was awesome. Keep it up. And it feels really good to get hugs from those that you love, especially while we're distancing from others. So remember to give your kids physical affection. And then what are 3 ways to show your child you love them every day? Or in older kids especially, what are 3 ways they can show you they love you every day? So this is an exercise, and you yourself reflecting upon ways that you like to express your love to other people, and make sure you're doing it consistently every day. But sometimes that's not enough. So it's important to look for signs, especially of anxiety and depression in kids and in yourself. And here are some signs. So if you're constantly hearing your child needing reassurance, they're reluctant to separate from you, they have frequent headaches or stomach aches, they're moody or irritable, or they're having frequent tantrums or meltdowns and trouble sleeping, consider that this might be getting to them and they might need some extra support with their anxiety. And depression, oh my, all this distancing has had such a bad effect on everyone. Unusual sadness, reduced interest, feelings of loss of anticipation and joy, difficulty concentrating, guilt, changes in your weight, changes in the way you sleep, you're not moving very fast, you're just feeling bad about yourself or thoughts of hurting yourself. So please pay attention to those. And then what should you do if you see those in yourself or your kids? At first, I encourage you to call your primary care provider. As a pediatrician, I'm seeing it a lot, and I do have some resources for you and some ways to help you. I can get you to a therapist, and I can also help start medication if we need to do that. There is a really great resource that's sort of new, and I think Nola probably knows about it and may know better than I do, but it's called COVIDRecoveryIowa.org. And they also have connections on Facebook, Instagram, and a YouTube channel. And they offer resources for you if you're struggling with mental health during COVID, or if you're struggling financially, if you have if your physical needs aren't being met, or your financial needs aren't being met. So definitely, if you know of someone who's struggling, encourage them to visit this website. There's also this Iowa Warm line. So it's 844-775-9276. That spells warm, 9276. And this is if you want to establish some therapy for some mental health services in Iowa during COVID. So it's all because we know that's needed during COVID. Also for your kids, healthychildren.org has plenty of resources about how to parent during COVID. It may answer a lot of your questions. And then this childmind.org has a great amount of resources about coping during COVID. Of course, there are plenty of others out there, but I just wanted to select a few for you. So just to summarize, yep, kids can get it. We're hoping to mitigate the risk. So if we are able to mask and hand wash and have people stay home when they're sick, this might get us through, right? Masking and face coverings are important. Schools need a contingency plan in case of outbreaks. Schools need to be great communicators. I know my school in Waukee are really doing an awesome job of communicating with families and being ready to pivot if things get worse. And we're leaning heavily on people like Nola to let us know how things are going. And then families need community support for educational health, right? Families don't know how to educate their kids. They need some more support. How are we doing this virtual situation? It's something totally new. They need community support for their kids' physical health, right? The kids aren't moving enough. They're taking in too much energy and not burning it off. Their emotional needs as well. So I'm going to finish there and say thank you very much, and I'm open for questions.
Thank you, Amy. We do have one question that came up while you were speaking from Nathan, who wanted to know, do you recommend showering or washing clothes upon coming home from being either in public places or outdoors?
Great question. And I wonder if Nola can weigh in on that too. Pediatricians have been doing this thing. I think my nurse called it being a garage stripper, where we come home from our work and we just take everything off in the garage so it doesn't even come into the house, and then throw it all into the washer right away, run up and shower and get everything changed. And So we've been doing that since March and just really paying close attention to every single thing that we touch or come into contact with. And over time, at least the pediatricians of the world have discovered that maybe we've been going overboard on the worry about fomites. So I don't know, Nola, do you have some comments about that?
Yes. You know, it's such a hard question to think, because I think that we want to do that, but in a sense, are we going overboard? I think the best thing that we can do when we go home is to immediately wash our hands. We know that's the biggest step to prevent this, is by washing your hands. I mean, Dr. Shriver and I know this. Think about how many times you touch your face without even knowing. We are such individuals that touch our face and we just don't know that we're doing it. So I think the biggest thing you're going to do, the best step you can take, is to wash your hands immediately.
I absolutely agree. And my brother calls it FFTs, frequent face touchers, right?
Yes.
Yep.
Mm-hmm.
And many of us, most of us are, but I have stopped doing the garage stripping so much. I do change my clothes after I get home from work, because I maybe have been in contact with someone with COVID. I'm certainly in the front line. So I change my clothes after that. But I think if I were grocery shopping, I would probably not change my clothes after that. And so I think you have to kind of, I think I'm less concerned about it now than I was originally. Originally, people were closing parks, right? Because you don't want kids climbing on the park stuff. And I think that sort of, people are taking a step back from that and saying, well, maybe we should let our kids play in the parks as long as they wash their hands, because our kids really need that physical activity and it's good for their mental health too. So, and I don't know of a lot of, park-induced COVID. I mean, if you're with a million people, probably you can get it from the people, but I feel like there's less concern about washing all of our clothes if we're just at the grocery store.
Thank you, guys. And again, just to reiterate to all our attendees, if you do have questions for Nola or Dr. Shriver, please feel free to type them in the chat and I can relay them to them. One I have, since you both have pointed out, things keep changing, things keep developing and evolving. What do you both feel are the best ways of staying up to date on these issues and on the stats and whatnot? What are some resources to pay attention to?
I think for Iowa stats, the Iowa coronavirus website has a lot of great information. You can see what's going around in your county and the counties around you throughout the state. I think the CDC has really great information, Centers for Disease Control and Prevention, about exactly what you should do in every different scenario. Their guidelines keep changing. Things will keep changing. This is such a fluid virus. So I think going to the CDC is your best resource as well. Dr. Shriver, can you think of any other resources?
Oh, I don't think we should try too many resources.
No,
I like those. I pretty much, like, for recommendations, when I give recommendations, I always follow what the AAP has guided me to. I don't make them up. They're definitely provided by the experts in the field. And likewise with the CDC, you're not going to find a more reliable source of information about what COVID looks like and what we should do to quarantine or isolate and what we should do for testing. I'm certainly relying heavily on that in my job.
We are as well.
Awesome. Thank you.
But again, I think, there's a lot of, not so much about the disease itself, but like, what do we do for our child's mental health and physical health? And I think there are great websites out there to say during COVID, staying safe, how can we increase our child's physical activity? And there are sites like YMCA 360 that have great kid-focused activities to do at home. So there's that. And then again, the websites that I offered at the end of my talk about mental health services, I would say, those have been designed. One of those was designed specifically for the state of Iowa's mental health support in COVID, and I think it's amazing. So
awesome. Thank you both. We have a question from Jen. She has a newborn, and she's wondering if there are any special precautions that you'd recommend for with that in mind.
Well, newborns are in, like, for the first 1 month of a newborn's life, they're in that higher risk category. So keeping them away from everyone is kind of good. You know, I had a lot of families call me during the first few months of COVID. Oh, we're delivering our baby. Can grandma come see the baby? Can we have people visit the baby? It's really a tough call, right? Because anytime you let someone in your bubble, it's just like Nola said, you don't know where they've been. So, it's always increasing the risk. But again, grandparents love their babies. So I think what Nola said is true. Like, I think I would have people mask around my baby. If they even came within 6 feet, I would have everyone wash, wash, wash. Never, ever, even without COVID, should you kiss your baby on the mouth, okay? That's just not okay. Don't do any mouth kisses. That's the #1 way babies will get sick, so don't do that. I do have an alternative behavior. So one thing that's really adorable about newborns is that they have what's called the plantar grasp reflex. So if you take your thumb and you press it to the little soft pads of their toes, they're gonna curl their little toes around your thumb and give you a toe hug. And toe hugs are very oxytocin releasing and lovely. So wash your hands, give your kids some toe hugs, and then just like keep them away from the germs as much as you can. They should still see their pediatrician. Usually we recommend within 24 to 48 hours after discharge for a weight check, and then continued health visits, including their 2-week visit. Some will recommend a 1-month visit and then the 2-month visit as well. So please keep up with your pediatrician, and then, make sure that you have a good way of contacting your pediatrician for any questions.
And I think, to go on what Dr. Shriver was saying, I think it's also just really important who they're around, It's almost, you don't want to ask your friends, do you have signs or symptoms, but you do. And I think you're just always better to be safe than sorry. What do you think, Dr. Shriver?
I think you're right. I think that's a great point, that people are a little bit timid in terms of that awkward moment when you have to ask that question. And I would like to empower new parents to be very bossy about it. This is your child. You don't need any extra germs around. So please feel free to Zoom with them if they want to see the baby. Because that first month of your baby's life, they are very, very vulnerable. And you know what? You want them to be around for the second month. So be selective about who comes in. Be bossy about if they even have any symptoms at all. Just say, you know what? This baby's just going to get cuter in the next month. So you can follow up with us in a month. And just do whatever you can to politely make sure that you are keeping your child safe. Absolutely. Don't be afraid to say no when people want to come over if you don't feel comfortable. This comes up a lot, even during RSV season or flu season. A lot of parents are like, hey, grandma refused to get a flu shot. Should I let her come around the baby? And so I think it's okay to say no. If it's peak influenza season and your friends don't have their flu shots, that's a risk, And right now, there's so many risks. So just do what you can to avoid risk.
And we always say that in public health. I mean, if you have friends around you that, if they're caregivers, let's say grandma's going to be in 90% watching the baby, and they haven't got their Tdap vaccine, I mean, that it's kind of the same thing. The child could easily get pertussis. So I think it's just, you need to be pushy, because this is just not the right time to be lenient on any situation.
And congratulations on your newborn.
All right, thank you both. I have a couple other questions I thought might be informative for other people as well. So I know cloth masks have become kind of the norm now, and I know I myself have kind of heard varying things about like the care and laundering of a cloth mask. So what are the recommendations right now for that sort of thing? Like, how often should we be washing these? How should we be storing them? What can you tell us about that?
I think, I joke about this, and it's kind of it's a funny way to relate it. but you wash your mask like you wear your underwear, okay? So if your mask is soiled and it's dirty, you wash it. We don't wear dirty underwear. You don't want to wear a dirty mask. I would recommend storing our mask in a in a paper bag. That way it can breathe and it can dry. Think about like a plastic Ziploc bag that will hold in the moisture as well. So, you know, and you can throw them in the laundry like you would throw anything else in.
And I completely agree with that. I would just take this time to add, like, try to make sure you have a mask that fits you properly, because if it doesn't fit well, it's not working. And it's uncomfortable and you're going to touch your face more. So really focus on, is this the right mask for me or my child? And there are lots of different masks out there for kids. So, you know, try and find one that specifically does a good job. If you order your mask from Amazon.com, which I guess many of us have, because that way we don't have to go out and buy it, please wash it before you wear it, because guess what? My husband got a huge rash from his face mask because it wasn't washed before he wore it. So there's always chemicals on them and things. So definitely wash them, make sure they fit, and then wear them properly over your nose, please. And try not to mess with it. But I would also encourage kids to get masks that are fun, because there are a lot of options out there, so many fun masks. So, you know, it's already a drag to have to wear one. So go out and find the ones that you love the most, so you're excited to put them on.
Thank you.
And also, if your mask gets wet, it's not working. So don't wear a wet mask. Like, that's definitely a time to change it. And like, if you can't swim in a mask, obviously not that kind of mask, and you can't like get it wet at a beach and have it still work. So just remember that masks have certain limitations, and a wet mask is an ineffective mask.
Awesome. Now this may be a question that you might not be able to answer. I'm curious if there are kind of any broadly speaking, are there certain situations or people with certain maybe afflictions that you would advise not to go to school or not to have their children attend school? Is there anything, you know, you can broadly advise that in-person school is not the best for them? Or is it on a strictly individual basis?
That's such a tough question, because it definitely depends on community prevalence, right? And it depends on the individual. So it's a great question to discuss with your provider. There are some people who have very high risk conditions that might lead them to getting a more severe version of COVID. So some types of cancer, if you have chronic kidney disease, if you have chronic obstructive pulmonary disease, not a lot of kids have that, but if you're immune compromised, obesity can be a risk factor, some congenital or repaired cardiac conditions in kids, or some grown-up cardiac conditions. Sickle cell anemia, type 2 diabetes, and then some genetic, metabolic, neurologic, and neuromuscular disorders in kids can put them in a higher risk category, but it doesn't necessarily exclude you from school. You know, what I found interesting when I read that list, which comes straight from the CDC, is that I was surprised to see that my cystic fibrosis guys weren't on that list. My beautiful, lovely kiddos who have cystic fibrosis weren't on the high-risk list, and I was so surprised, because, you know, their lungs, right? But, you know, they're on a slightly, like, downgraded list of risks, and they're so used to mask wearing. Like, they're like the best mask wearers of all time, and so so this is nothing new to them to do these safety precautions. They probably could teach them, you know, write the book on it.
Another question from Nathan, wondering any recommendations or thoughts about young children at daycare not wearing masks while the teachers do?
Right. Well, you know, praise to those teachers, right? Thank you, teachers, for your early care and education. You are the rock and foundation of all future brain development and health. I'm a big fan of daycare providers and early childhood educators in general. My mom taught preschool for a really long time, but I just know how much brain development happens and how important they are to that overall child's health. Yeah, younger kids. So definitely if you're under age 2, no masks for you. Babies, nope, no masks. If you're over age 2 and you're doing a great job wearing your mask, great. I've seen it happen a lot in my clinic. So it can be done. There are other countries where kids are just taught this is what we're doing and the kids just do it. So I think a lot of kids who are 2, 3, 4, and 5, if they're not doing it well, it's maybe they need a little more role modeling and just a little more positive encouragement to do it. Now, some kids it will increase their face touching, and especially if they have a mask that doesn't fit. So in some cases, those kids can try wearing a face shield. Again, doesn't work for everyone. So you have to use some of those other distancing measures we talked about, the hand washing and the completely disinfecting and cleaning all the time, as well as the quarantine isolation strategies that Nola had mentioned. So Nola, what do you think?
I think you're exactly right. I think we know that there are kiddos that are just not going to be able to wear masks, especially as our younger ones. And I think as long as we keep following all of the mitigation strategies, I think that's the best thing that we can do in this situation.
And it's so hard because parents really rely on daycare and preschool to get to their jobs. But honestly, if your kid's sick, you can't send them. You can't. And I'm really sorry about that. But that's the number one mitigation strategy is if your child's sick, don't expose them to the other kids. It's just going to really be hard for parents right now because of that, because kids do get sick at that age at a higher frequency than older kids. And it's really going to cause a lot of struggle with their jobs. And right now, everybody's sort of on edge with jobs. Lots of people have lost their jobs. And so, you know, we as a community really need to have a lot of grace and understanding and support when families need to isolate or quarantine.
Thank you. I have a more general question. We've talked about so far how symptoms of COVID seem to be so varied, so common to other diseases or maladies. Things seem to be changing a lot. To what extent is this normal? Like, is this how a lot of other diseases behave, or is this something particular to COVID?
I think that COVID is a coronavirus, and so you know there's been a lot of research previously on those types of coronaviruses. This coronavirus is new, and it is different than the other coronaviruses, and we have had very little chance to really see what it's capable of, what it is, and what it isn't. And so, I mean, we are really learning as we go with this. And, you know, at first we thought, oh, it's not even as bad as influenza. But then we changed our minds. And then we thought, oh, it's passed along by respiratory droplets. And then we changed our mind and thought, well, maybe it's a little bit airborne. And so I really think that it is different in a lot of ways than other viruses we've come into contact with in terms of we don't know exactly who is able to transmit it. We initially, as you saw in my talk, thought that kids maybe weren't transmitters, and now we think they maybe are. So again, all of this is evolving as we learn and study the pandemic. So I think that the thing that's newest of all to me as a provider is that I've never had to deal with a global pandemic before, never had to stare in the face of this and try and figure out on an individual basis what to do, at a public health level what we need to do, for a school and educational safety issue what we need to do, for mental health issues. So for me as a physician, it's been a very new and challenging world. So I would go with new. Nola, what about you?
I could not agree more. I think every day we learn something new. Every day it changes, and we're we're just really, we haven't had a chance. It was, here it is. This is what's happening. It was, you just had this disease fall in your lap and you had to learn as you go. And I think that's what we'll continue to do. So yeah, this virus is just, it's something we have never, ever seen before. And it's something that it's just, it's just out of our wildest dreams. So I think that we're going to keep learning about it, and they're going to keep finding different symptoms or different ways that this looks like. And that's just all about learning about this disease and figuring out the best ways that we can succeed and live a healthy life as a country.
And I do love the question. I like the reflection, and I think that is what a lot of physicians and public health experts have been doing, is reflecting upon what we have seen in history and what we do know, and comparing. So, you know, a lot of us hearkened back to the 1918 influenza pandemic and what mistakes were made and what decisions were made that turned out to be good decisions. So we can learn from history, and we can study other pandemics to say, what are the best strategies for managing and mitigating? So we learned about not throwing huge parades and things like that. And then, you know, in the polio outbreaks, we learned about, you know, pools got shut down, schools got shut down. So, you know, people have experienced similar shutdowns in their lives due to infectious diseases. So that in and of itself isn't new. It's just that this particular one, we don't have a great handle on yet, and we're certainly trying our best. But, you know, every challenge is new. We do have a lot of history to lean back on. We do have a lot of experts working on it. But the complexities of trying to apply public health in this world is extremely complex, very challenging. And when you need to consider the needs of children outside of their physical health, it becomes even more complex.
All right, thank you both. To our attendees, any other questions that you would like our guests to answer for you? Okay, I think you all have answered a lot, a lot of questions, given us a lot of really good information. I want to thank you both again for joining us and providing us with all this great information, everything up to date. So thank you very much.
And Caitlin, may I add one last comment?
Yes, please.
You know, there are a lot of polarizing issues around COVID that have made people very unkind at times, irritable, unkind, just aggressive in some ways. And so I would just like to offer this, that everyone is out there trying to do their best, and everyone is just trying to live their life in the best way that they know how. So you may not agree with what your neighbor's doing or what the person next to you at the grocery store is doing, but please, let's have some grace with each other, because this is a very hard time no matter who you are, and everybody's struggling in a different way. So try to be as graceful as you can with the people in your life and the people that you live nearby and with, and try not to be unkind on social media, as we're all just really working hard and doing our best as well. So a little bit of grace will go a long way as we try and solve this big puzzle.
And if we have grace, we can get through it together.
Thank you. Thank you both. All right. Well, thank everyone for joining us this evening. And I hope you have a good rest of your week.
Thank you.
Thank you.